Welcome this morning to Be Connected Support Services Outbreak Response Team Training. We've been looking forward to this training for a few weeks since we decided that it was essential for our organization's COVID-19 outbreak responsiveness plan. Although this is perhaps the only group or committee that I hope never has any work to do. And I mean that, best case scenario, we don't ever have to trigger the use of our ORT, but in the event that we do, we want to make sure that people feel as prepared as possible for the job ahead. And so we sought out Augustus Copps, who's a registered nurse, and he's over on the mainland. He's the director of services of a similar organization called Bernard C. Vinge. Is it Vinge or Vinge?
Vinge.
Vinge. On the mainland. Augustus does a few things with Be Connected, actually. So he also helps us in our children's programs with our with the nursing support that we require there. And so he is familiar to some of you, maybe some of you more better than others. And so I'd like to welcome Augustus. He and I and Rhonda and Chelsea had a meeting last week to discuss, was that 2 weeks ago now? 2 weeks ago, to discuss this training, and I'm super excited to see what Gus has to say, and do please keep track of your questions. If you have questions as we go, Gus will let you know the best way to ask them. If he'd like you to ask them in the moment or to write them in the chat, that can be directed by Gus. After the training is over, if there's feedback from people about the training, about what if there's anything that you think that you're still missing to be able to put the plan into action, then by all means, just reach out to me. We have a great working relationship with Gus, and I can get those, if there are questions that we aren't able to answer here at the office, or we need to have them informed by a bigger authority or expert, then Gus has made himself available to us for that purpose. So with no further ado, thank you and welcome, Gus.
All right, so a couple of things. Just I would recommend that everybody have pen and paper for questions, and then we can review those at the end of this training, make sure that your questions are answered. And if you have more questions afterwards, you can direct those to Kristen, and then Kristen will connect with myself and we can answer those questions. So I'll just tell you a little bit about myself in a very short time frame. I'm a registered nurse. I've been a nurse for just about 40 years. I graduated here in BC. I worked in many areas of nursing prior to community living, including intensive care, CCU, ICU. I've been through other pandemics in the past. One of them that I went through, in fact, when I first graduated, the AIDS pandemic was extremely strong. 3/4 of the patients in ICU were AIDS patients that were very, very ill. And we had to use significant PPE and follow protocols at that time. So I learned very early on in nursing the importance of PPE and the importance of maintaining really good precautions. I've been in community living for 29 years. I joined Vinge and Associates 29 years ago. I am now the principal of Vinge and Associates, but I'm a working person. I'm a registered nurse that's always kept up with my education and my knowledge. I'm a consultant. I work directly with individuals. I'm also part of Health Point Institute, which is an online training company, which is actually also owned by Vinge and Associates. But I'm a principal in there, and we train thousands and thousands of community living workers and staff all over BC in regards to different health topics. So in regards to this, I'm involved with maintaining up-to-date information in regards to COVID-19 on a daily basis, not just for myself, but for my nursing consultation team. We have a team of 5 full-time nurse consultants that work throughout the Lower Mainland, Fraser Valley, and also Vancouver Island. And one of my responsibilities is to make sure that I have the finger on the the finger on the pulse in regards to what is happening, so that my nurse consultants stay safe, but also that they can communicate any urgent concerns in any area that may be affected, so that we can respond quickly. I've been involved with other outbreak response teams for several other associations and organizations who also have put together outbreak response teams. Our organization has had one since May, actually. We've started it very early. But several organizations have asked also for this training. Most agencies now do have outbreak response teams, and that is a really good thing. And so one of the first things I want to say to you guys that are all online here, taking this training, that I admire what you're doing, volunteering for this team. You should be proud of yourselves, because you are giving of yourselves when you're doing this, and that is admirable. So I just want to say thank you for that. And although I'm not part of Be Connected myself, it has to do with the fact that you guys are supporting very similar individuals in community living, and that's what we do. And so community living thanks you, CLBC thanks you, and of course your organization thanks you for joining this team. So that's that. So today we're going to cover quite a few things, but we're going to focus on very specific things, so that you're very clear in regards to what may happen in regards to a positive COVID-19 diagnosis. And that's what this is about, right? The outbreak response team will be responding to a Be Connected supported individual being diagnosed with a positive COVID-19 test, okay? So the purpose of this team is that it's a special staffing team to provide in-home direct care for supported individuals diagnosed with COVID-19. That is the purpose. The outbreak response team will respond as a team to provide in-home direct care for an individual or individuals, because you may end up having two individuals in one home being diagnosed with COVID-19. And this is very important, that are stable enough to be cared for in their present home. So that is what you will be doing. If you have a positive COVID-19 individual and they are rapidly becoming significantly ill, including breathing problems, you will not be working as a response team in the home anymore, because that person will go to the hospital, okay? So this is for the individuals that are stable enough to be cared for in their present home. And that actually is the majority of people. The majority of people that are diagnosed positive with COVID-19 do not go to the hospital, okay? It's a very small percentage that actually end up. So if you do have a positive COVID-19 diagnosis for one of your supported individuals, most likely the outbreak response team will be called to action, okay? When a supported individual is diagnosed with COVID-19, which means a positive test result, immediate isolation of this individual would be necessary. So what does that mean? It means that someone was showing something. It may have been a low-grade fever, right? And you're going, okay, they got a low-grade fever. When I say low-grade, we worry about with COVID-19, usually we'll see 37.8, 37.9, maybe 38. And you go, okay, do they have any other symptoms? And you go, you know what? They got a slight cough. Okay, test. That is indication of a test should be done. A test is done and they come out positive. So that would mean that individual would be isolated to their room. Now, this is, of course, not easy because of the individuals you support, right? Not everybody will understand, people that you support, not everybody will understand what that means for them, right? Why do I have to stay in my room, right? It's not going to be easy, especially with some individuals that have issues around that, right? So there will be some challenges in regards to that, but it is very important that that does happen. Otherwise, this individual will be spreading the COVID-19 or shedding, what we call shedding this everywhere, right? So that will be one of the aspects of it. Then the service provider will immediately initiate their COVID-19 response plan. Okay, that's what the system is best served in regards to how to best support people that are then diagnosed with positive COVID-19. So Be Connected has the BSS coronavirus, COVID-19 exposure control and continuity plan. Is everybody aware of that plan? Yes, good. So that is important. So one of the things that is important is that all members of this team here, so you guys that are online here, you should review the plan presently. That means you should read the whole plan presently right now, so that you don't try to do that, because you may be called to action tomorrow, So you want to make sure that you review the plan completely beforehand, so presently. And again, if the team is called into action, make sure you're immediately, okay, what's that? I got to be updated. I got to make sure that I'm aware of this plan and how we need to respond. Management at Be Connected will, of course, then initiate their aspects of that. What does that mean? Well, if somebody's diagnosed positive, then your Island Health will be contacted in regards to that. If it is a licensed home, licensing will be contacted, because that is a protocol. What will then happen is certain things will then automatically be initiated. You will be contacted, or Be Connected will be contacted by Island Health, and they will then assign a specific person to your program. That's what will happen. And they will then immediately ask you for a bunch of things to make sure you have. And one of them is, do you have a exposure control and continuity plan? Do you have a response plan for this? Yes, we do. Do you have an outbreak response team? Because not every organization has one, and you guys will be able to say, yes, we do. Okay, so what is your plan in regards to this? And then you will be talking about that, and then they will give you guidelines in regards to, okay, this is what you can expect from us. This is the type of support that you can expect from us. So immediately, the person is assigned, they will be communicating with one person of the agency, and the agency will then decide who will that be for the agency. So that will be the key contact person, so that anything that's asked for, any updates will all be communicated directly with that person. The good thing about this is that the response is very, very rapid. It is very timely. We know that because we have an experience of that. Okay, and I'll share that with you very quickly. We did have 2 staff that were diagnosed with COVID-19. It's not individuals, but staff. They did not get that through our agency work environments. It was their personal networks is where they picked it up. We immediately did our response plan, which included calling Vancouver Coastal Health, which we did. They immediately assigned us somebody for our team. And then immediately we went through the process of what was expected of us, which would include, because they did work 2 shifts in the home, everybody in the home had to be tested, including the individuals and all the staff. But because of really good PPE policy adherence by the staff, I'm happy to announce that not one single other staff picked up COVID-19, and none of the individuals in the supported environment picked up COVID-19, which was extremely pleasing, not to us as an organization, but it meant also, the big thing is, if PPE is worn properly and is used properly, it absolutely works in preventing spread. So that is a very important thing to remember. So with that, we have the experience of how the health department responds to you. So, and then we were given guidelines on, what should we do for the period of testing, even although we didn't have yet a positive. What was recommended, and we of course followed that recommendation from Coastal Health, is until we have the test results for all the individuals, we did go to full PPE, meaning we went into full mode of PPE just in case, because we didn't know at the time if any of the, say the individuals, they could have been positive, right? So we had to wait for the results to come back. We did go into full, it was about 3 days of full PPE. That meant gowns, gloves, shields, masks, everything. We used the full N95 mask at that time until we had the results. And once we were happy to announce everything came back negative, we went back to regular PPE. So that is one of the things that will be recommended, most likely also by Island Health if you have a situation like that. Okay, so that is what you will be expecting from Health Authority. Will also give you guidelines. Now you will already have, and I will explain what they'll most likely tell you, but you'll have it in place already in regards to, okay, the individuals are stable enough to be at home. So you'll be looking after them at home with your outbreak response team with proper use of PPE. Then they will review with you in regards to the donning and doffing stations, as an example. They will then tell you, do you have a plan for that? Yes, we do. What is it? Okay, you explain that. Okay, perfect. Second of all, your home will have one entrance and exit. That is another thing that the health authority will instruct you to have, which is you will choose a door, and that'll be the only entrance and exit to that home that will be utilized. No other door will be opened. And the reason for that is you don't want to have exposure through more than one door. Okay, you will put signage up on the door, which means that this home is an isolation home. Do not enter without permission, meaning nobody comes in without permission, and that includes the staff. So what does that mean? You don't just walk in. The staff will open and communicate with you so that the staff know that the person walking in is allowed to be in, because it's going to be extremely limited as to who can go in and out. And that includes only the working staff, health authority individuals, and any health professionals that has been assigned to that home. That is it. No family members, no visitors, nobody else goes in or out. So that's extremely important. So they will go through that. They will also come and inspect your donning and doffing station. That will happen. We'll explain donning and doffing stations after, but they will inspect that to make sure that you're adhering to the recommendations. Okay. Then they will connect with you on a daily basis. They will connect with you on a daily basis. And again, it will be the assigned person. You'll be talking to the same. The key person, the key contact at Be Connected will be connecting with the same person for Island Health in regards to the update. So that is an expectation, again, for continuity, and that there is no communication breakdown. So and that is very important. And again, that is what they're doing. So, right? Because we want to make sure that all communication is absolutely accurate with any COVID-19 response, especially like this for community living and an individual being supported in the home. We want to make sure that a positive test does not result in what we call an outbreak. Okay, a COVID-19 positive test for one supported individual is not considered an outbreak. An outbreak would be if suddenly 5 staff at that home or 4 staff at the home were also diagnosed, and now we've got everybody in the home also. That's an outbreak. Okay, one person is not. That's simply a positive COVID-19, where the outbreak response team will still, but it's not a total outbreak. And what I mean by outbreak is, when you see the Bonnie Henry, when she comes on daily or 3 times a week, she mentions about, and then when you hear the news, we've got a new outbreak. One positive response, test in one home will not be considered, and you won't be mentioned in that outbreak. An outbreak will be when you have a true outbreak. Okay, so so that's what it is. Licensing, depending, not all of your homes are licensed. Licensing will get involved, of course, with any of the homes. Okay, and that's important because they also will be monitoring, and they will also be connecting with the key person on a daily basis. Monday to Friday, and just to see, is everything going okay? Is everything being followed? Is there any other concerns, etc.? You will also be sharing your in regards to the expectation of what to expect with health authority. They will ask you for your exposure control and continuity plan, and they may critique it, and they may also give you some feedback on that plan, meaning either they'll say, we're totally happy with this plan, or they may say, we would recommend that you add this to your exposure and continuity plan. Okay, so that's part of what the health authority will be involved in. So The non-licensed home recommendations, of course, are that you treat it no different than a licensed home. Why? Because I understand that with unlicensed home, yeah, there is a little bit less, focus on that from, health. You, as an agency, you do want to maintain the same level, and I'm sure you do, but it's very important that you also follow it exactly the same. Why? Because that's going to help with maintaining control and preventing spread, meaning more contamination. Okay. So again, right now it's a 2-week isolation once a person is diagnosed, and at the end of the 2 weeks there will be a retesting done for an individual, and before the situation is considered clear. Once the situation is considered clear, it will be the health authority contact person that will say to you, then you can now go off of the full PPE, right? They're going back to their regular PPE. It's up to them to make that announcement with you. So do remember, after 2 weeks, you don't just go, okay, you guys, we're going back. No, you have to check that, and health authority has to okay that, okay? And in regards to some expectations from the health authority, they will expect, and some of the things they will ask for is 24-hour contact number. And again, it doesn't mean that the one key person at Be Connected will be 24 hours, 7 days a week, but there will be a contact number required where they can reach if there is any major concern in the middle of the night or something like that, that they have an immediate management contact number and person to be able to be connected with in regards to, do we have to change anything in regards to this plan, okay? And there's a number of reasons for that, because even although we may have everything in place and everything going smoothly, we can never predict certain things. And what I mean by that is, suddenly we may, and we live on the West Coast here, right? And you're on the island, and suddenly we may have a weather change. And suddenly there are 100-kilometer-hour winds right during this time, and you're on day 4, and now your power is out. So you got issues, right? Meaning, and now they predict, and BC Hydro says, oh, this is bad. We're going to be 48 hours no power. Okay, so do you have 48 hours of backup power at that home? So these are the kind of things you want to make sure are also part of your plan is, okay, we're going to have a 48-hour power failure and we have to keep the people at home and we can't move them. How do we address that? Okay, well, the answer is generator, right? So it doesn't mean you have to have a generator at every home. It just means you have a generator available, right? Ready to go as part of this in case you do have that. So these are some of the things that health authority will throw at you in regards to that, and just be ready. And again, recommendations always to be ready to answer those kind of questions. Okay, so that is what to expect from the health authority. We're doing good on time. So is there any question on number 1? Any question for number 1? You can unmute, and if you have one, you can unmute and ask me the question. If not, we can go on to number 2. Okay, sounds good. Okay, so appropriate use of PPE now and during an outbreak. All right, so this is also a flowing issue. And what I mean by that is we've seen a significant number of changes, right, in regards to recommendations since we started this whole pandemic situation here in British Columbia, right? There was a time when, as you are aware, right, there was a time when the health authorities and the health experts said masks are not necessary. That was not in the beginning, right? No, mask use is not really needed, right? For everybody to use a mask. It should only be used in the hospitals. That was a recommendation back in February, right? How things have changed today, right? Now it's everybody should wear a mask in any indoor situation. So as you can see, because not everything was known about COVID-19, things change, and because of that, we need to be on top of that. Now, in regards to PPE, you all know that recently some things have changed in your homes, right? Cloth masks were okay last month, right? Then a study comes out and it says cloth masks are not adequate. So suddenly the recommendation is surgical mask will be the minimum, right? That's the recommendation. So, and I understand that you just want to clear that up or clarify that, Kristen. That is the case with COVID, with Be Connected, correct?
Yeah.
Is the answer yes?
She just stepped out of her office, Gus, but yes, we now have procedure masks in all the homes.
Okay, so that is important. So now, as you know, with the new recommendations in British Columbia, indoors and also in any work environment where you have close contact, that you wear masks at all times. And that is an important one. So what is the expectation or the recommendation of appropriate use of PPE right now? So without an outbreak, surgical masks, important thing, one aspect of that is that we have to make sure that the minimum is 3-ply. Okay, so that's important. So it's 3-ply surgical masks. Okay, there are some masks out there that are 2-ply, not enough. 3-ply is what you want because it means that you have a waterproof barrier in the middle, and that is important to prevent particles, not just large the prevention of large particles, but also the prevention of small particles. Okay, that's important. So 3-ply surgical masks, extremely important. Now, it's not just important that there's a policy on that. It's very important that there is adherence to that, right? So appropriate use of PPE, and this is for all the staff, right? Because we do see, I mean, I work with a number of agencies and I see and I visit a significant amount of homes. And I see a lot of inappropriate or what we say improper mask use. And I have to remind people to make sure that you wear their masks properly on a regular basis. And I find that sometimes very difficult because, you know, I work with agencies that are not our agency. I'm a guest at homes and I don't necessarily want to, you know, supervise them, right? But I have to say something. I'm a health professional, but also I'm a person who doesn't want to get COVID-19. And I don't want people to spread COVID-19 or bring COVID-19 into a home and then infect a supported individual. So, and from personal experience, and I'm going to share this with you, and this is personal. I had to be tested for COVID-19 on Monday, which means just a few days ago. And I'm very happy to announce that my result was negative. And I'll tell you what happened. Not Tuesday, but the week before Tuesday, I was visiting a home for another agency. And I came in and there was a staff member who walked towards me to say hello. And his mask was under his nose. And I looked at him and I stopped and I put my hand on. I says, "Can you please put your mask on properly?" He said, "Oh, I know. You know, I just find it so uncomfortable." I said, "No, I understand that, but that's not the proper use of your mask. Can you please put it on?" And then later we had a teleconference with a doctor, and the individuals behind me. And then I noticed on my screen from the computer while we're on a Zoom call with the doctor, he's got his mask off. And I turned around and said, "Can you please put your mask on?" He says, "I know, but I'm just sweating so much." I says, "I don't care." Right? So Friday, I get a call saying 2 people at the home have tested positive so staff members have tested positive for COVID-19 and you were exposed to them. And I said, "Well, thank you very much." Yes, I was. Right? And now I was wearing proper PPE and I make sure I test it, I wear it tight, etc. And what does it goes? It goes to show you that although I was in the home more than 15 minutes, exposed to somebody that was not, and had to be reminded to use their PPE properly, I was exposed to COVID-19, but I did not get COVID-19. So what that proves is if you use your mask properly, your risk of getting COVID-19 is significantly reduced. So kind of evidence of that, right? But it's very important. and that, because for me it's frustrating that people don't, but also the risk to the people you support is high, right? So important, really important. So we don't want the masks to be under the chin. We don't want it to be under the nose. When you put your mask under your chin or your lower chin here could have virus on there, and then you're putting your clean part on there, and then you're putting it back on your face. So never on your forehead. All the things that people do. The answer is no. Wear it properly. Okay. During an outbreak, PPE changes, and we'll talk about that in a minute. I'll show you all the recommendations from BC here. But you change that, you will now go into what we call full PPE. What is full PPE? In an outbreak, you're going to go, and you are part of the outbreak response team, you will be using N95 masks. N95 masks have the best protection. Why? Because they are made and have been tested to not only pretty well keep out the large particles, pretty well 100% of large particles, but more than 95%, that's why it's called an N95, more than 95% of all small particles are not able to penetrate this. If two people are wearing the masks, like say two staff, and both are wearing, it's pretty well 100% guaranteed there is no passing of anything. But for an individual that you support, even although let's say they cannot wear a mask, you are so safe with that. And on top of that, you will also be wearing face shields. So when you add an N95 mask and you add a face shield, you are 100% protected. Okay? Now, we can never say 100% because if for some reason somebody still gets it, people will go, what didn't work? Well, I'm going to say, yes, it did. If somebody wears all that gear, the N95 mask, the full face gear, the gown, the gloves, and you still end up getting positive COVID-19 testing, it most likely will be the result of self-contamination, okay? Meaning the breach of the virus to you by accident, not on purpose, but totally by accident, but you may have done something. And in many cases, it will be something really small, but so important. And one of those, because I see people do it on a regular basis, people get an itchy nose and they go like this and they go like this. They've just put themselves at risk for the COVID-19 from their gloves into their nose because they had an itchy nose. So these are the things that pass COVID-19 to staff. So in most cases, when a staff member in a hospital, in a home, in a community living home, whatever, gets it from an individual, support individual, in most cases, if not almost all cases, it's self-contamination, okay? Not on purpose, again, totally by accident, some kind of a breach happened, okay? And that's one of the things we'll be covering, that you don't get that breach, okay? So again, appropriate use of PPE now, surgical mask, 3-ply, make sure you wear them correctly. You know that on top they have the wire inside. Make sure you seal it properly. And then if you have fogging, reset it. Again, put it against your nose and make sure you press the wire and test again. What you don't want is fogging, because when you have fogging of your glasses, when you're wearing a 3-ply surgical mask, it means there is air coming through there. If there's air coming through there, small particles can also go through there, and that means out but also in. So make sure you fit that properly, okay? Then make sure it's under the chin properly and it's secured well. Okay. Very, very, very important. Once you don a surgical mask in the home, never then touch the outside of that mask, because that's the contaminated part. You want to just, when you remove it, you want to make sure you remove it like that, right? And if you want to reuse it, use a clean paper bag, label it with your name on it, put it in there while you're doing something, whatever it may be. you're in the bathroom, etc. And then when you put it back on, you always, and the reason I'm saying that is just to make sure you don't make a mistake, okay? But otherwise, always never touch the outside so that the inside of it can clean, because you can use that surgical mask for the shift. When to change it, sometimes you do require 2 masks during one shift. Why? When? If it gets moist and too wet, you want to change it, okay? But otherwise, you can use it throughout the shift, okay? No problem with that. N95, the same thing. You will be using the N95 mask throughout the whole shift. If there are, say there's a home with, let's use a home with 5 people being supported, and there's 3 staff for the days, and there's 3 staff for the evenings, and 1 overnight, you will be using 7 masks, N95 masks for a 24-hour period, right? 3 masks for the day shift, 3 masks for the afternoon evening shift, and then 1 mask for the overnight, right? Now, if you have 2 diagnosed people in a home, it won't be 1 person overnight. It'll increase, right? You need, because there's going to be more attention needed for the individuals. You would have 2 staff for the overnight, okay? Just again, otherwise the person at night would be too overwhelmed, okay? With a positive outcome. So again, PPE for non-COVID-19, right now what you have no diagnosis of COVID-19, mask is what you will be wearing. Otherwise, you will be following the same universal precautions, standard precautions, protocols that Be Connected already has, right? When to use gloves, when not to use gloves, etc. Washing your hands, all these things remain the same. The only difference at this time with this COVID-19, there is recommendations that we do use more stronger soaps, okay? So that we know that for this present pandemic, we want to make sure that we keep our hands significantly clean. So be aware of that, right? Again, with hand washing, because I still see it, right? I still see a lot of hand washing that lasts about 4 seconds. And I see that, and 4-second hand washing is not hand washing, okay? But I do see that people open the tap, they go like this, and they close the tap. And you go, that's not hand washing, right? Hand washing has to last how many seconds? Anybody? Somebody want to throw an answer back at me?
20.
Happy birthday twice.
20.
Minimum happy birthday twice, and not too fast either. So in other words, happy birthday, like that, right? Twice minimum.
Yeah.
And I know that sounds kind of silly. So, well, that's what I teach my children. Yes, but that's what you have to do. But believe it or not, I still see 3 to 4 second hand washing happening in homes I visit. And again, for me, it's difficult, but I have to say something, right? And I just say, guys, you know, especially with this, and I use COVID-19, it should be all the time anyways, but I use COVID-19. I says, hey guys, with COVID-19, you know that really, you got to really wash your hands longer and proper, right? Because people, you know, sometimes you just do things too quick, and bugs are not killed in 4 seconds. And bugs are not killed when you don't use any soap, which I also see. I see taps going on and I see no soap use. That's not hand washing, right? Okay, so again, we know what PPE is for now, and with during an outbreak, it's going to be full PPE. Again, full PPE, just a quick review, is gowns, masks, face shields, gloves. That is full PPE. Okay, we want to make sure. And then added to that, of course, is your hand sanitizer, your garbage container with a lid, and your laundry basket with a lid. That is your PPE setup. Okay, so when we're talking afterwards with the donning and doffing stations, that's what you'll be setting up. Okay, any questions on number 2?
I don't have a question, but I did just want to offer to everybody on the call, so that everybody is aware, that all of the items that Gus referred to, PPE items, all of the supplies that are needed. We do have a healthy store of them ready to go when needed, including for that terrible scenario that you offered of a COVID outbreak occurring at the same time as a windstorm and a 48-hour power outage. We also have a couple of generators.
And I want to compliment you on that. And it's really important because about 9 years ago, we had a home that had 2 people on ventilators, right? And I won't spend too much time on this, but we had a power outage. And I don't know if you remember, about 8 or 9 years ago, when we had this unbelievable storm, including an ice storm, and we had no power for 4 days. 4. So we had 2 ventilators. How did we do that, right? Well, it was not easy. We had already planned with backup power and all this kind of stuff. But we ended up literally running out of power. So much so we had to then scramble, right? So sometimes you just can't predict what may happen. And when I mentioned a 48 power outage, that is not out of the question. About 8 or 9 years ago, we had a 96-hour power outage. And that was most of the lower mainland was out with no power for 96 hours. So it's not unheard of. And again, you have to plan for that. Okay. No other questions for number 2? Number 3 is short and sweet. The BORT staff, it's an ORT, but the BORT meaning Be Connected team, secondary close. So be aware that when you're called to action, the recommendation is that you will have a set of clothes that you'll be wearing when you are working at the location that will stay at that location. So you bring in a bag with those clothes. You come in with your clothes, but you will change into those clothes that you'll be wearing for the shift. You'll be properly putting the clothes that you'll be going home with in a bag, clean environment, completely clean environment. And then the clothes that you'll be wearing at the house, you will not leave from that house. So what will happen is you'll work, and at the end of the shift, the next shift will put or you can put those right into the washer. The shift that comes on will then make sure they're put in the dryer, and they'll put them in. At the end, we'll fold them up or hang them up, and then put them in the clean location. You'll be putting that on when you come on. Okay, so that way you're never going home with possible infected clothes. Okay, so it's similar to a nurse is not allowed to come with a uniform, work, and go home with the uniform. Although I see that breach all the time. All the time, which still shocks me, right? Because if you go downtown Vancouver, you'll still see nurses and doctors walk around in their uniforms on the streets, right? With a coat over it, right? And you go, no, you're not supposed to do that, but they do. It's a breach. You're taking bugs out and you're bringing bugs in, right? So don't do that. Have a second set of clothes, okay? It's a very easy thing to do, but it's a very highly recommended thing to do, okay? That way, you're never taking home possible contaminated clothes, okay? Any questions on number 3? No, okay.
Yes,
Roll of
yes.
dawn. Oh, go ahead.
Yes, sorry, I have a question that doesn't include underwear.
No.
Okay, just
No.
saying.
No, good question. Nothing wrong with that question.
Okay.
Just the outside, right? So,
yeah.
And again, my recommendation to everybody is this is the best opportunity to put on your most comfortable clothes, right? So put on a sweatsuit, you know, a loose fitting jean, you know, not too tight, nice loose fitting jean, and a nice sweatshirt, you know, with a nice pattern on it. Maybe even something bright so that, you know, because what you don't want in the home when you're having this for 2 weeks is gloom, right? You don't want to have depression and gloom. Make something happy so that you get positives, right? What you want is as much positive in that environment, because it is tricky, right? You're going to be isolated for 2 weeks, although you're only working a 12-hour shift. You're going to be isolated in the sense of nobody can come in and out, that kind of thing, right? So you want to make as much positives. And this is also where your agency, I know, will support you well, because they will be phoning you and FaceTiming you, those kind of things, or Zoom you, just to make sure you guys are all doing well, okay? Because it's not only that you're doing your job, but also that your mental health and that you feel that you're being supported, right? And I'm sure your agency will do that and respond very positively in regards to that, okay? You guys are doing something really great. And again, it's admirable. And you need to be thanked for that. And the agency, I'm sure, will give you that positive feedback. All right, so role of donning and doffing stations. When you have an outbreak, I already mentioned, right? You can have 2 exits and entrances, correct? Is that correct?
One.
Okay, I'm testing you guys as we're going on, all right? Only 1 exit and entrance, okay? And I'm going to throw these things at you throughout this training just to see if you're paying attention. 1 entrance and exit. Okay, so you're going to be putting together donning and doffing stations. So donning means applying, putting on. Doffing means taking off, okay? There are differences between donning and doffing, okay? When would you see more hand washing and hand cleaning? During donning or during doffing? Anybody?
Both.
Which one?
Would it not be both?
Nope. Which one would have more? Donning or doffing?
Donning?
Doffing.
Doffing, correct. Why?
Because you're taking it off. You have to be clean afterwards, after dealing with the mess.
Exactly, because you're contaminated or possibly contaminated with doffing, not with donning. With donning, you're cleaning yourself and you're putting on clean stuff. With doffing, you worked with the individual who was positive. So now you have to be extremely careful, right? Because your mask could now have COVID-19 particles on the outside. Your gown could have COVID-19 particles on the outside, right? But when you put it on, was there COVID-19 particles on there? No. So when you don and doff, doffing will always be more intense in regards to hand washing. In fact, you'll be surprised when you see the BC Health recommendations regarding doffing. You will be surprised with that. Okay, so donning and doffing stations. How many stations do you think you'll have in a home? Minimum. How many?
Minimum 2.
Minimum 2. 1 at the entrance and 1 at the outside of the person's room. 2 doffing stations. If you have 2 individuals with COVID-19 positive, how many doffing stations will you have? 3. 1 on the entrance of the home, 1 at each entrance or outside the room of the individual. Okay.
Gus, can I just ask a question? It's Rhonda. In some of our homes, like, so for example, the 3 resident bedrooms might all be side by side. Are you suggesting that there'd be 3 stations or 1 out in the hall would suffice? Like, I just am thinking about our capacity to be able to have that many stations.
If everybody, remember, the individuals do not leave the rooms, right?
Correct.
So you're going to have 1 outside every room. And can anybody, including you, Rhonda, tell me why I would suggest 1 outside of every room?
Cross-contamination.
Absolutely, cross-contamination from one to the other, right? So therefore, because you see, if you have 1 individual who tested positive, but the other individual is actually shedding way more than the other, everybody sheds what we call shedding differently, right? So you don't want to cross-contaminate. And of course, with other aspects, there's something else that you may be cross-contaminated. So the recommendation. Now, remember, donning and doffing stations doesn't mean we have to have a huge a table, right? You can make a fairly portable donning and doffing station. Donning and doffing station does not mean that it has to be huge. It has to contain what? What items is a donning and doffing station? Gowns that are folded nicely on top of each other. That could be in a tiny cabinet. Masks. Each staff member that's working for the, let's say there's 2 staff members working at a time. There's 2 masks, but most likely those masks are very specifically labeled and hanging somewhere. You understand what I'm saying? So when you have that, you'll have the gloves, you'll have the masks, you'll have the hand lotion, of course, there, the cleaner, and mask, gloves, and gowns, right? The face shield, because you're not going, if you have supporting 6 individuals, you're not going to have each staff member having 6 shields. The shields can come, but the staff will clean the shields between individuals. Okay, very important. You can't have 6 shields per staff member. That's just too much, right? So my suggestion then will be you'll have cleaner before, if they're using the shield, they will decontaminate a shield properly first between individuals. Okay, and that's easily done, correct? You can use the antibacterial wipes on them and make sure that that outside, including, I would first start with the inside and it's clean, and then use the outside. Okay, and then they can hang so that it's clean when you're using it. Okay, but the other stuff stays at that donning and doffing station, only outside the room. But it can be a small little cabinet, and the gloves, depending on the individuals and the staff you are working there. Some agencies will have small, medium, and large. A number of agencies will only have medium and large. So if it's only medium and large, those are the 2 gloves that you'll have there. So they're on top, you'll have 2 gloves. In the drawer, you'll have the masks, and in the little door there, you'll have your gowns. You're set. Doesn't take up a lot of room. Any questions on that? So just make sure with the donning and doffing stations, because Island Health will inspect them, that you have everything. Now, what I would recommend that you would have with each station, as I mentioned, your actual face visors, you're going to have 1 per staff, and it'll be, their name will be on it, right? And you'll clean them in between. But you should have goggles. Goggles are cheap, couple of dollars. I would put goggles, adequate amount of goggles on each station also. You know, the plastic goggles, I would put that also as part there always. Okay, because if you don't have time for the face shield cleaning, you have the clean goggles there. And so on the station, goggles, gowns, gloves, masks, gloves in 2 sizes, and of course the hand cleaner. Okay, that is your donning and doffing station. Okay, make sure, because you could have a what we call a inspection visit. That does happen, and just that is with experience. You will have an Island Health person suddenly show up at the door, like literally suddenly showing up at the door. If it's a licensed home, don't be surprised that licensing will suddenly be at the door. And they may also know, because you'll have a sign that says, please use the back door only, because that's what you put on your front door. Let's say your front door is closed and you're using only the back door. It could also be the front door you're using. You'll have a sign on using only the other door, right? They will purposely knock on the wrong door. Okay. Again, those are what we call surprise visits. They want to make sure you guys don't breach protocol. So if that happens, do not open the door. Say to them, please use the back door. Do not open the door, because when you open the door, they'll say, hi, I'm from licensing, and I just wanted to check, but it appears that you're opening the door that's not supposed to be open. And there you are, right? So do not open the door, and they will do that. And also they will have surprise visits for things like the donning and doffing stations. Check and make sure. So when they come in and you have no gowns on the entrance there, or you have something's not, so make sure the staff always or you guys of the response team, make sure you always are restocking as needed. Okay. Then the other check will be proper use. In other words, they will review to see if you're using things properly. Okay. Any questions on donning and doffing stations? We know now minimum 2. We could have as many or 3 or 4 doffing stations, but minimum 2 doffing stations. Proper supplies. We've already mentioned the items, right? And making sure that they are properly filled up.
Okay. I have a question, Gus,
Yes.
just some clarity. So we have an outbreak, and staff are wearing the N95s. Are they wearing them all day long, like how staff are required to wear masks now? Or like, because I'm just a bit confused as to how many N95s if we're having to switch masks in between each donning and doffing period.
I'm not sure, but okay, I'm going to clarify that.
So I guess my question is that right now when from persons served or their colleagues. So now we're in an outbreak situation, an employee arrives to work, they don on, and I'm more concerned about whether like my understanding was that one N95 was sufficient per employee per shift. And so I'm just not clear when you're saying a new mask during each donning and doffing period.
Okay. I'm just going to get, okay, I see what you're saying. And I guess I did make an error there because because of the fact that, because we're going now with masks are compulsory at all times now, right?
Correct.
I'm thinking of infection control. Okay. So the mask stays on. So that's the one item you don't have to change. You understand?
Okay. And so your shield will prevent any breach then, as long as it's clean between patients.
Well, unless you're wearing goggles in an emergency, your shield will do that. Yes.
Yeah. Okay. Thank you.
Okay. So, but the rest is changed. Okay. So what does that mean? If you have one person, it's very easy, right? And the likelihood it will be one, but again, it could be 2. If it ends up to be 2 individuals in a home, you will change the gowns between those people, right? Outside the doffing station. You will change the gloves, but your shield, as you know, you can clean that between people. Then you have your mask underneath that. You are not contaminated because the person talking to you, the particles are hitting the shield. As you come out, then you clean inside and out, right? But because of policy being that at all times now we wear masks versus what it was before, we now know that you cannot, because some of the practices before we would change N95 to surgical masks again. You know what I'm saying? We don't do that now because simply the order is now that we're using masks all the time. Now, some people are uncomfortable, are not able to use an N95 for 12 hours. Okay, that question has been raised before, and the answer is even nurses at a hospital have some difficulty with that. So you are allowed to remove the N95 mask and switch to a surgical mask when you're not in direct contact and you're completely out of the room of the person that's contaminated. Okay, and we will show you how to do that also in a minute. Okay, so not everybody is comfortable wearing an N95 for 12 hours. In fact, a lot of people are not. So how do we address that? Yes, if you're not doing direct contact care, you can remove your N95 mask and put it on, replace it with a surgical mask. Now, how do you do that? You have to do that in an isolated area. You cannot be doing that while you're, less than 6 feet or even 8 feet away from another staff member, right? You do it in an isolated area, and I will then give you, show you in a minute, a video that shows you how to do that. And then change to a surgical mask when you're not with the contaminated person. Okay, that is allowed in that once you're out of that area. But once you're being providing care, you're in full-fledged N95 again, right? Any questions on that?
Could you use the same mask in the same day, or once you switch the surgical and go back, do you need a new N95?
No, you're using the N95 for the whole shift. You can safely remove the N95 and store it, and we'll show you a video how to do that. I'll just give you a very quick explanation. You can take a surgical mask off, an N95 mask off, and put it into a clean Tupperware type of container. That is, one of those lunch containers. While putting it right in there, taking it off, you put the elastic over it. It's now snapped on there on the outside. You take the mask off, the clean part's outside, and you take that and you put it into a clean paper bag. You haven't touched the inside of that. You haven't touched the outside. Once you put it back, you take, and of course the paper bag has your name on it. It's only yours. Then when now you got the surgical mask on, now you have to provide care for an individual again in the room. You take it out, you put it on your face, you take the elastics, and you take the Tupperware off. You haven't contaminated anything, and you've put the mask on. And you can do that for the shift. After the shift, we dispose of it. Okay, that's so you can use it again throughout the whole shift. It will save money. N95, and it's not just saving money. Okay, we're not going to talk it's all money. It's not just that. The supply of N95 is limited and this is not only in BC, globally. So we want to make sure that we don't overuse it. So if you do have three staff, and then 2 staff at night, say you're using 3, 6, 8 in a 24-hour period. Okay, and then because it's 14 days, so if you're using 8, you're using over 100, close to 120 masks, right, for that 14-day period. So that's a lot of masks, right? That is $1,000 right there, right, just for masks. So, and again, it's not just money, it's supply. We only have a limited supply. So that is a safe way of doing it. And then people can feel more comfortable because, again, an N95 is a little trickier to wear. So just to clarify, because I did confuse you guys a little bit, but I want to just clarify that because I'm thinking in going into the contaminated room, but I was thinking of going into the contaminated room as a normal, infection control that I'm used to. So remember, with COVID-19 at this time, everybody wears the masks. So therefore, yes, you got the N95 mask on with the face shield. You only have to clean the face shield in between people. The mask stays clean that way, right? From getting that. Everything else stays at the donning and doffing station. You do not share. You do not have gloves, and now you go to the next individual, right? You make sure those gloves are off. You take the gown off, and then the gown doesn't have to immediately go into the laundry, right? At the doffing station, as long as you keep the inside of that gown clean, you can hang it up again, label it. You can put it back on very carefully as long as it's clean. Okay. Now, if you're reusing it, your hand washing becomes more intense in between putting that on for donning, right? It becomes more like doffing, meaning you're going to wash your hands or clean your hands more often. Okay. You never share the gowns in between people and the gloves, of course, right? And you clean the face shield in between people. Okay. That's important. All right, any questions on that? So how many doffing stations again? If we have one person contaminated or infected?
2.
2. Okay, if we have everybody infected in a 5-person home, how many?
6.
6.
6.
Correct. 5 plus 1. Okay.
Can I just quickly interject again, Gus, just to speak to a couple of questions that have come up in the chat. First of all, we do have Rubbermaid containers for storing N95 masks are a part of our kits.
Perfect.
I am making a bit of a shopping list here, like for instance, the paper bag idea is a good idea. We do not currently have paper bags, but it's on the list for shopping this afternoon, and we'll go into the kits. And I just want to, I see that Rhonda's replied to Crystal. So if you look at the chat, Crystal's asked a question. I just want to speak to that a little bit because it's a feedback piece that's come to me a couple of times. I understand to the JOHSC as well. And I've seen some feedback in our current staff surveys that are out. It's just not, we have 12 staffed residential homes, so it's just not reasonable for us to set up full outbreak kits times 24 plus in each of the homes. It's also not a responsible use of supplies. It's very unexpected goodness that we would have 12 outbreaks occur all at the same time. So that's why we have the kits in our office spaces. You know, by the end of the day, with these couple of extra things that we need to put in them that we're learning about, they'll be ready to just pick up and go or be delivered on short notice. I've also made note, Linda, that we will send a couple of kits up your way so that you don't need to collect them from head office. But I do just want. Yeah.
Rhonda already generously gave me a kit. I have one up there.
Okay, with all the supply, like garbage cans and everything?
Yeah, except for the garbage cans and the paper bags.
Okay, good. So I do just want to make sure everybody understands, because this question has come to us over and over again about the supplies that we have. We do have a lot of supplies and we are keeping track of them, and they will be, you know, we're not being cheap with them. We are handing them out in a responsible way. So you can also reassure your staff about that for folks who are on the call that are representing coordinators from homes and our occupational health and safety committee, because those questions do keep coming in, and it seems like maybe staff are not trusting or something that the supplies do exist and that they will be available for you in the event that they're needed.
Perhaps we could take a picture of the storage room and all the invoices and put it on ShareVision. That might be some reassurance.
And just to clarify from our end, right? I mean, we're also an agency that provides services, and we have 9 programs. We have one full kit because we have one isolated program in Victoria, so we have a full kit there. Otherwise, we have one central home that has all the supplies and our office. So we have 2, and we have protocol, and we have not just a protocol. We have already a plan completely in place that if we have an outbreak, we already have identified who will then go, and then there's a backup person. Like literally, it would take no more than 90 minutes for it to arrive at the location, all of the supplies.
Yeah.
Now certain supplies, of course, are already there. Things that we have put in every home is a garbage can and a laundry bin. But otherwise, especially the N95s, because I'm going to be honest with you, and this is not in no way, you know, to say people are, you know, N95 masks will go missing. So they're too expensive. I'm sorry. They got to be in a central location. Okay.
Yes, that's a reality. So we have to be.
That's a reality. I'm same with us. I know that for us, it simply go missing. So, and not because people would steal them, people would use them because they would feel more protected in them. And so we don't put them there. We have them because we have a supply that is adequate for several responses, literally for our biggest house, several responses. So we've overdone it, but we want to still be responsible, right? So what you're doing is absolutely correct. Any questions? Can we go on, Dan, or is it all good? All right, so taking PPE on and off, we're going to go there now. This is dawning. Can you all see this?
Mm-hmm.
All right, so this is from Ministry of Health, British Columbia. So we want to make sure that we follow the recommendations, okay? As you can see here, I'll just throw this out there. Okay, number 1, hand hygiene. right? Why? Well, of course, you came from somewhere else, you touched something else. So hand hygiene is what we want to do first, okay? So making sure your hands are clean. So we'll wash our hands at this time, especially when you have a positive COVID-19. If you're going to use a soap at this time with COVID-19 and you have a positive outcome, please use an antibacterial soap. That does not mean that if it's not an outbreak, you have to use an antibacterial soap all the time, because you're going to be using the hand cleaner when you're in direct contact, right? So at this time, so at least a minimum of happy birthday ×1, correct?
×2.
×2. Good. Gonna trick you on this, right? So you can see, you start with you start now again, because you see, and then I was reviewing all my material too. See where I ended up with the mask, right? This is the normal procedure when you're putting it on brand new, right? But because of the new recommendations, you already have the mask on, right? You see what I'm saying? This is how you normally do it. But because now here, even now, before number 1, number 0 is you already have a mask on because of the new recommendations we have. Okay, so gown, get it on, get your mask on. Now N95, this is important. N95 do require proper fitting. Okay, so what does that mean? My recommendation is that you have some health professional or a local respiratory technologist that you just connect with, or with Island Health, somebody that can come out when we have the outbreak. You don't have to have it done at all now. Some people will do it ahead of time, but it's not a must. But when you have the outbreak, you want to have somebody come by to demonstrate to the team the proper fitting. What does that mean? We want to make sure there's no leakage. And as long as you have a sign off from a health professional, and that could be, and you might connect with a local nurse, or you might have a nurse in a family somewhere that will come, or an RT, a respiratory technologist, or somebody that works for an organization that can do that. And all that is just to make sure that the mask is properly on and people understand clearly how to test it. And what does that mean? An N95, when you put it on, it's a really good fitting mask, but you still have to make sure you fit it in properly, making sure there's no leakage. And then you have to test it. How do you test it? Is that you're actually pushing it and you're blowing. And what you're looking for is any leakage when you actually blow out. That's 1. 2, the vacuum test. Is meaning is you breathe in, you should feel the vacuum on your face, similar to if you know snorkeling. That's that tightness when you breathe in when snorkeling. That's similar, because when you have that, that means there's no leakage. When you're able to breathe in and your mask actually sucks to your face, that means there's no leakage, and that's what we call the mask fitting. And normally, and it only has to be done once, but some agencies have actually taken the team and had them meet at their offices and have somebody come by that does mask fitting. You may have a local agency there that will do that, and then it's all done already for the whole team. You can do that. That's one option. Or the other option is, because again, you may never have an outbreak. It does cost money to have that testing done, and they'll probably charge you, either they charge you, whatever they charge, $150 for the visit, or they may charge you $40 per person, that type of thing. Again, a lot of agencies know, let's wait. We can do it right on the spot, or have a health professional do it once you have an outbreak. Okay, so that was just a clarification on N95 mask fitting. Okay, and that's just to make sure that people are aware. Now, again, because we're also using full face shields, and the recommendation on that is to make sure you have face shields for everybody, right, for the team. And then I would add an extra 3 or 4 face shields on top of that team. So if you have 10 members, you should have 14 face shields ready, right? You have that extra, because why? You have a couple of them break, you've got backup. So always add a few face shields that thing. And once for the team, once you have an outbreak, you will actually have each face shield labeled. It'll be for the whole outbreak. The person owns that, right? We're not going to share that anymore. So every member owns their mask with their name on the mask with ink that cannot be erased. Okay, permanent marker on there. That is your face shield. Okay, so again, hand washing, gown, mask, shield, and then gloves. The difference now, if you're already got your N95 on, then you will have that on, then you'll hand wash, gown, your mask is already on, and then you'll face shield. And the face shield is cleaned in between people with the antibacterial wipe. Okay, any question on the antibacterial wipe cleaning up the face shield? And then you put on your gloves. Okay, any questions on the donning? No question? Okay, doffing, of course, is different because you first remove the item that you last put on first, which is your gloves come off first. Why would you remove your gloves first? Anybody?
First, because you can cross-contaminate with the glove if you touch anything else.
Absolutely. And of course, what's most likely going to be always your dirtiest item?
Your gloves.
Gloves.
Your gloves. Okay. So your gloves come off first. Now you notice number 2, perform hand hygiene. So then your gown comes off. Now this one shows your gown then puts into the laundry, right? Again, if you have plenty of gowns, right? Like lots of gowns, then you can use them once, like use them once and launder them, right? If you're, I'm talking about if you're using the linen glove. Are you using paper or linen, Kristen?
Paper.
We have both.
We
Yeah,
have
both.
both. Yeah,
And how big is your supply of paper gowns?
we have a large supply of paper gowns, a smaller supply of fabric gowns.
Okay, and again, depending on your outbreak, right? Your linen gowns can be laundered and you can reuse them. Even a paper gown can be reused, not the whole shift because they'll end up ripping, but you just want to make sure that the inside doesn't get contaminated and the outside can be put in this or hung in a situation such, and then people understand what's hanging there, it's dirty. When it's not folded up in the doffing station, it's just hanging there, but it can be reused. Okay. Again, by the person that was using it. Okay, so then you would label it, and in most cases, you will assign for that 12-hour shift, you'll assign one person to that person, right? So therefore, the likelihood of that contaminating is not. The reason you want to do hand hygiene, because when that person removes the back of their gown there, that back is most likely not contaminated, right? So that's why you want to hand wash it. You want to not contaminate your gown. Then you hand wash again. Then you remove your next gear, which is your face shield. Now your face shield, you will still clean it with sanitizer, you know, the afterwards. But what it's doing here is that certain aspects, your straps, you know, you want to make sure they don't get contaminated. Hand hygiene again, and then your mask, right? Now again, with masking, we're gonna have it in the Rubbermaid or whatever containers you're using, because you're going to be changing to a surgical mask, right? So you want to make sure you stay clean. And then at the end of everything, we hand hygiene again. So this way you are protected. You are removing infected or possible infected clothing and materials, and you're clean again. So that when you're in the hallway, going to the kitchen, you know, making lunch, that kind of thing, you've got the surgical mask on and you're clear, but you're out of the area. Okay, any questions on that? So you see hand hygiene being so important with doffing, right? It's the recommendation to make sure. Now, is this being followed all the time, for instance, in hospitals? And the answer is no. And again, this is not in criticism, it's just because of the fact that they're running off their feet. It's very easy to things to be skipped. And that's when cross-contamination happened.
I have a
Right.
question.
Yeah.
I got confused about the order.
Yeah.
So starting at the beginning, you started talking about hand hygiene And then you said you have to start with the mask on. And then we went to gown, shield, gloves.
Oh,
And
you're
then
talking about donning, right?
Donning, yeah. And then doffing was gloves, gown, shield, switch masks. I'm confused. I wonder if you could just sort of recap quickly the order of donning and the order
yeah.
of doffing.
I will. Okay. See here, normally, but because of the new policy where we have to be wearing masks all the time,
Mhm.
this was before that policy is.
Mhm.
So in fact, even this, if you go to BC, they haven't updated this yet. Right now, a lot of people are already wearing the mask here before number 1. Okay, so normally you hand wash, you gown, and then you put your mask on, right? But you're already wearing it. So therefore, if the mask is on here, you're skipping this part because you've already got it on. But you're going here, here, and here, and then here. Is that clear?
Well, yes, except I'm using an iPad, and so I can't really see the diagram. It's very, very small.
Oh,
And-
sorry. I'm sorry. I'll make it bigger.
Okay.
There.
Yeah. Okay. So, but if you could just so we have numbers 1 through 4 for Dawn and numbers 1 through 4 for Doff. I
Yes.
just wonder if you could just quickly summarize what they should be.
Okay. Basically now, because of the new, it's 5 steps, right?
Okay, 5 steps.
5 steps, but because of the recommendations now that you already have the mask on.
Okay. So number 1 is mask on already.
Mask, no, number 1, of course, well, you got the mask on, yes. Mask is already on. Then hand wash, gown, eye protection, gloves.
Okay, hand wash, eyes, and gloves.
Because you
Okay.
already have the mask on.
Okay,
Okay, so doffing, taking off,
okay,
gloves,
okay,
gown off, goggles off, with hand washing in between, right? Now, this can still stay, and the reason this can stay is why? Because we can switch here to from a N95 to a surgical mask, right? Do you understand what I'm saying?
yeah, I do.
And then hand wash. Now, when you're going back in, you'll probably, well, not you probably, you will. What you'll do first in a clean area, you'll switch from a surgical mask to your N95, right? Like now you're out of the room, you've made your lunch. Now you want to bring lunch to the individual's room and give them lunch. You change your surgical mask to an N95 again, if you have changed it. If you haven't changed to a surgical mask, then this step is not even done. You keep on the N95. Do you understand what I'm saying? Is that clear?
Thank you. Yes,
Okay.
thank you.
So it's got to do with the fact that today we keep the mask on. You put the shield on and off to protect that. Okay, but you are allowed to change from a N95 to a surgical mask because simply 12 hours of a N95 is not easy. There is a certain different style of breathing with an N95 mask. Who here has worn an N95 mask? Anybody? Okay, you will find that when you put it on, you actually have to get used to breathing. And at first, you may actually want to take it off once in a while. This is during just at the beginning, and be careful not to contaminate. But people will loosen and go, oh my, because it's different. You have to breathe in a rhythmic way because otherwise you will be short of breath. You have to breathe through 5 layers of material. An N95 has 5 layers, and you have to breathe through those layers, and you may end up short of breath. Some people hyperventilate because of it, okay? So that's why I'm saying it's not easy to use an N95 for 12 hours. you most likely will want to go back to surgical mask when you're not in direct contact with the person that you're supporting. And that's the reason we're using the switching of the N95 to the surgical mask. Is that clear for everybody? Any questions, Kristen, from messaging?
Nope, that's good. Thank you. And just to for those who can't see the chat because you're on smaller devices, these posters are included in the outbreak kits, so you will have access to them in the moment.
Okay, and I will also send everything I'm showing you here will also be forwarded. Some of this you already have, and I will of course everything that I'm doing here I will be sending on. Okay. All right. Hand washing versus sanitizing. Anybody want to give me the difference between the two? Nobody?
One is washing the bugs off, and the other one is protecting the hand from the bugs.
Yeah, I mean, both of them are to make sure that your hands have lost, the viruses and the bacteria, right? But hand sanitizing, one is for when you need rapid hand cleaning. It's used around stations, the donning and doffing stations, because you're not going to have a sink beside every donning and doffing station, okay? So hand sanitizers are used. Hand sanitizers minimum, how many percent alcohol minimum, everybody? Anybody? What's the percentage minimum for alcohol for hand sanitizer? 70%. So that's the 70%. There are some products out there that have 50%, 60%. That's not adequate. It's not enough to kill the bacteria. 70% alcohol-based hand cleaner is what's required. Okay. There have been a number of hand cleaners recalled when they didn't have the proper level of alcohol in it. Okay. Hand washing, again, happy birthday twice. At the moment, especially when you have an outbreak, we're going to use antibacterial soap. Once we have the outbreak over, back, in 2021, I'm going to suggest November, December of 2021, we will be over all this. Supported by Be Connected, so that we understand what numbers, if there are a number change in their baseline, should we be worried or not? So that's kind of what this is for, and it's a very useful tool. And so basically it will give you the baseline, and what we want with that, of course, is to identify the individual. So this is all there, name, date of birth, etc., where they're living. And then we're getting a baseline temperature. What is, for some individuals that may have a metabolic issue, they may have a baseline temperature of 34.5, 35 degrees. That's a very low temperature, but that is because they have some kind of a metabolic issue. If they have a temperature of 36.5, for them, that's a fever. So if you didn't know that they had a very low baseline temperature, right? We support people. I have people that we support in our professional nursing support services that have baseline temperatures as low as 34 degrees. That's their baseline because they have certain metabolic disorders, right? And if they get a temperature of 37.5, that would probably be, in our numbers, 40 to 41. So, but if we didn't know their baseline, we wouldn't know that. So it's important to get a baseline temperature, a baseline pulse, because some individuals, again, have very low pulses. I support individuals with baseline pulses of 50. That's a very low pulse. That's called bradycardia, but for them, it's a normal pulse. So if they have a pulse of 80, that for them is very fast. but for normal people, it's not, right? 80 is perfectly normal, right? Same with breathing rate. Some people have very low normal baseline breathing rates. Some people have very fast. So we want to have a baseline. Oxygen saturation, that's a really important one for COVID-19, because it's the breathing. The reason people go to hospital is not because of a fever. The reason that people go to the hospital is not because of the pulse is a bit out or the breathing is out. It is when they have problems breathing. So not slow rate, fast, problems breathing. When they go, I feel very tight. So the reason they come to emerge is my breathing is very tight. I'm fine. I'm short of breath. My breathing is tight. They do an oxygen saturation on them and find that this really healthy individual has an oxygen saturation of 80. And they're normally a healthy individual. So when they're short of breath and they have a saturation of 80 and their chest feels tight, should they go to the hospital? Yes,
Yes.
absolutely. And so the people you support are the same. So we want to get baseline for everybody. So that's what this is. And I believe, Kristen, am I correct that you will be using this form?
Yes, yep. So I sent out the form just yesterday, actually, to our home coordinator so that they could familiarize themselves with it before our session today, and the supplies in order to do the testing were ordered. Rhonda, are they in yet?
The blood pressure cuffs are in. I'm just waiting on the oxygen saturation clips, and they're supposed to be in tomorrow, I think. So we'll hopefully get those kits rotated through the homes next week.
Perfect. All right. So from there, where you put in, and then on the end there, I've got when should you these are all part of what the Health Canada recommendations are, and these are some of the signs. From this particular one, you guys will set protocols in regards to that. So what you individualize, and that's not too difficult to do, right? So once you know your numbers and you have somebody with positive, then health will look at what, and they'll ask you, health will ask you, Health will ask you, what's the normal baseline? You got it ahead of time. So when you have this form completed before an outbreak happens, you say, oh yeah, we got it, here it is, perfect. Then they'll also help you and assist you in regards to guidelines to say when this individual needs to go to hospital. And it will typically be that they will say if the supported individual gets short of breath or their oxygen saturation drops below a certain point, take them to the hospital, call 911, take them to the hospital. Okay, that's most likely what you'll be told, but you guys will be one step ahead of the game because you'll be monitoring that, right? Every shift you'll be monitoring, okay, what are they at? And if you see here in your pre-existing form, it said that their oxygen level, their oxygen level was 96%, let's say, and you're monitoring every shift and you're going 96, 95, 96, 97, 94. Are they going to hospital? Are we taking them to the hospital? No.
No.
But now you go in and you go, the breathing is a bit different. Their color is a bit off. You do their saturation and it's 84. Do they go to the hospital?
911.
911 right there. See how you picked it up immediately? You got the tools, you've got the baseline, you got the knowledge, and you know now. There's no question asked. Look at that. You went in, their color changed. It looked like their breathing was a bit different. You throw the saturation machine on there, you see. And if they have an oxygen of 84, their pulse rate is probably running at about 130, 140 right there. 911. You have done the perfect thing. You've checked them, you've monitored, and you've done everything right. You'll get them to the hospital, and they will most likely end up in ICU. Okay. The first thing they're going to need is they're going to need oxygen. Okay. That's the first thing they're going to need is oxygen. But when they're 84, normally 96, and they're short of breath and their color's not well, they most likely will end up fairly quickly in ICU. They're going downhill very, very rapidly. Okay. So, but you're picking it up, right? So, and you're going to have the tools in there. Again, that does not mean that Be Connected has to buy a pulse oximeter for every program. As long as you have it in your central, ready to go. A couple of them, right? Send one up island, and then you have maybe a couple in thing that you can get these baselines done. Somebody can go around and make sure that's done, right? Visit and then do that. You don't necessarily have to buy them for every program. We have decided to put an oxygen oximeter in every program. We have decided that, and we got a really good deal of I think $60 or something like that, $65 for a really good one. So we ended up buying 9 of them, right? So we have one in every program. That does not mean that you have to do that, right? Okay, so that's the individual form. Again, very useful tool to have a baseline. I find it not only useful, I think this is really important. Okay, any questions on the pre-existing condition form? Okay, good. All right, so we go back to here. Monitoring TPR, we've got here, we're doing good for time. All right, so when we talk about what is normal, very quickly to review, I'll forward this to you too. We have normal ranges that we want to see. That does not mean the individuals you support are always within these numbers. As I mentioned, some individuals' metabolic issues will have lower baseline temperatures, right? We support people that have temperatures of 30, 34, and that for them is normal, okay? But normally, a temperature is between 36.5 and 37.1. Normally, an adult normal pulse is anywhere between 60 and 90 at rest. And this is an important thing here. It's at rest. Can you guys see this?
Yep.
Okay. At rest, okay. Respirations or breathing rate. This is normally 14 to 20 breaths per minute at rest. Always at rest, right? If an individual is active, these numbers will be up, but you don't measure it when they're active. You always want to have the baseline being at rest. Okay, we wait if they've been walking, we wait and they've been not walking for at least 30 minutes before we do the baseline. Okay, so those are your normal. So it's there where you want to see how far out from normal people are. A temperature above 37.5 degrees Celsius is considered a fever. Anything below 37.5 is not considered a fever. For COVID-19, federal and provincial health guidelines are using a temperature of 38.1 degrees Celsius or higher as a fever to watch for COVID. Okay, that does not mean that if they have a temperature of 37.8 that you wouldn't follow that up, right? You know what I'm saying? All they're saying here is this is what their federal and provincial health guidelines are saying. But what I will say to you is if they have a temperature of 37.8 and they also have a cough, I would still get them tested for COVID-19, okay? All right. Baseline oximeter. Oximetry, we want to take that and we measure it on a warm finger. If a finger is cold, warm the finger up, because we're going to be measuring the color of the blood, that's what an oximeter does. It measures the color of the blood by using infrared light and white light, the two lights into the finger, and it reflects and it measures the color. That's what an oximeter does and gives you the oxygen level in the blood that way. So document the baseline oxygen saturation, temperature, pulse, breathing rate. So this is for your pre-existing sheet. And also prepare a protocol for each person. So when you're seeing this, right, we can already have the protocol. So if an individual is 95 to 99%, as an example, let's say everybody at one of your homes is all 95 to 99%, meaning all in the normal range for oxygen. Levels below 90. You can set a simple 90 as being the number. If they go below 90, they're going to go to the hospital and get checked out. Okay. A pulse above 120 or the resting breathing rate is above 28 and or, okay. So if they've already been diagnosed with COVID-19, you're supporting them. These are kind of the three numbers you will use saying they're not doing well here. Okay, so anybody in the home as guidelines, they should go to hospital. Okay, we don't want to wait till it's 85 or 80, because otherwise they could either, one, they could die, or two, they could end up on a ventilator if we don't get them to the hospital quick enough. Okay, so these are the guideline numbers you can use. Now, if an individual has a lower oxygen level, right? Let's say a baseline for them is 91 to 92. Now, you may have nobody that you support that has this, but I'm just throwing this out here because we do, with our professional support services, we do have so that is how if they were 91, they go below 86, we're taking them to the hospital. Okay, and the same with these numbers, stay the same. Okay, so that's what we use, are 5% less. But again, once you do your monitoring of everybody and have filled out these forms, I have my doubts that you'll have anybody with these numbers. You'll probably have them all here. But if you do have one or two individuals with these numbers, then you can use 5%. Any question on that? Does anybody have any question on this?
Nope.
Okay,
Nope.
good. Boy, you guys are good. Okay, now we go back to this. So, identifying when a hospital transfer may be necessary, I've already mentioned it. What other reasons do you think maybe when you need to transfer somebody to the hospital?
Sorry, could you say that again, Gus?
Identifying when a hospital transfer may be necessary. I already mentioned, right? If
Yeah.
their oxygen, if their normal oxygen is between 96 and 99, and it goes below 90, they go to the hospital, correct?
Correct.
If they were lower, it's a 5%, right? If they're
5%.
short of breath, pulse above 120, 20 at rest, above 28 breathing rate at rest, they all go to the hospital. But identify to me or give me other reasons why we may have to transfer somebody to the hospital.
Oh,
Temperature
their
gets too high.
temperature is too high.
Yeah, if suddenly you go, oh my gosh, the temperature shot from 38.1 to 41.
They have a cough that
And
They
the
normally
cough is
don't
getting
have-
really bad, but their oxygen was still. But guess what may be happening here is they're developing a pneumonia. And their oxygen saturation hasn't quite gone down yet, but their fever has spiked to 41 degrees, or they may have gone septic. Okay, so yes, if you suddenly see another reason. Okay, another reason.
A significant deterioration in a short period of time?
Yeah, any significant deterioration. You guys know the individuals well, right? And also do go with 6 sense, right? And 6 sense meaning you go in and you go, no, this is not good. This is not good. You don't want to only follow my recommendations. You also know the individuals you support. And when you come into the room and you go, no, they're not doing well, call 911. You can never go wrong here. Now, what's the important thing to say to the operator of 911 when you call? Anybody?
I don't know. We have a
If the patient
potential.
has COVID.
If the person has COVID.
Absolutely. You don't, not potential. You say, we're supporting somebody at this home. I'm calling from a group home, let's say group home here. This is at the moment a positive COVID environment. We have a patient with COVID-19 diagnosis that we were supporting in the home with Island Health support, but they are getting very ill. Please send an ambulance. And then they will keep you on the phone. They'll ask you, say, well, and you'll be able to say, their normal oxygen is 97, it's 85, they're short of breath, they're colored, they're turning pale, and now it looks like they're turning blue. And they will say, we're sending a team immediately, okay? So what will happen is they'll arrive immediately. They will apply oxygen. Absolutely immediately, they will apply oxygen. They will also have their intubation kit ready. What does that mean? Sometimes people will deteriorate in a matter of 10 minutes, and then they will intubate, possibly even in the home. Intubation means they will put in a tube into their trachea to help them breathe, because sometimes people literally go from being okay to not being okay in a very short time. Okay. Now, I'm not trying to scare you here, but that can sometimes happen. So make sure you identify it. This individual with COVID-19, we're supporting them in the home. They are rapidly deteriorating. They're short of breath. Nice words to use. They are short of breath. Their color is not good, and their oxygen level has gone down to this level. Okay. Kind of those are the three things, and you will get immediate and rapid response. Okay. All right. So now we have 10, 12 minutes. So let's open it now. Thank you very much for being patient with me. And again, we had that little glitch with the mask, but that was, again, we've corrected that. But otherwise, I want to open it up to questions. Kristen, do you want to be the person kind of quarterbacking the questions?
Sure, I can. So you can ask questions or put them in the chat and I will pose them to Gus. But Gus, I just want to say on behalf of everybody, thank you. That was excellent. I feel much more prepared myself in an hour and 48 minutes. So thank you so much.
Yeah, no problem.
Yeah, thank you, Gus.
Yeah, no problem. Okay, go ahead with questions.
Guys?
Questions.
About any one of these, or if you have a question that I haven't covered, that's also okay. And I'll do my best to be able to answer them. If I cannot answer a question, I will research it and I will get back to Kristen.
I have a question. When there's
Yes.
no residents in the house and we're
Yes.
eating, are we allowed our masks off? I know
Yes.
for eating we can't have to, but
Well,
if the
yes,
residents are no home,
yes, but how far away from each other?
it will either be nobody's home or a staff in a manager's home, and hopefully there are 6 feet distancing.
Well, that's what I'm saying. If there's no individual, so the individual that's isolated is in the room and you're in the kitchen, the team is allowed to eat. But remember, you must maintain proper distance at all times when you're doing that. Now,
Okay.
my recommendation is only one person eat at a time. Only one person removes the mask at a time. That would be my recommendation. Okay. And I'm not trying to make people feel, oh, how come that would be the safest way to eat. So one person's eating. One person is eating and the other person is watching the meat. No. But it's better safety that way. Okay. So yes, but can two people remove them as long as they are? I would not even go with 6 feet. I would go with 8 to 10 feet apart. Because again, when you're eating, what may happen when eating, as we know that sometimes people have a cough, right? It may be you swallow a little bit different, or it's just a little bit higher risk. So therefore, I recommend one person eat at a time. Next question.
For the surgical mask we wear now,
Yes.
pre-COVID outbreak, what's the life expectancy on those? I tend to wear mine on and off, so I can't stand it anymore. And then I get a new one and get pre-COVID confirmation.
Are you talking about your personal one or the one for work?
Personal one.
Oh yeah. Well, as you're aware, some people wear them for 2 weeks.
Yeah. Okay. There's no.
And the answer is no.
Nope.
You shouldn't wear it for 2 weeks. Can you wear them for several days? Yes, you can. But what do you need to do? It's again, follow the way that you do. So again, even for personal use, recommendation is that you keep the mask folded with the clean inside, always clean. Hand sanitizer before you grab it, then put the mask on and hand sanitizer after, and you can use it for a week. So as an example, one that you may have in your car, right?
Mm-hmm.
Fold it in half, hand sanitizer before you even touch it, hand sanitizer, remove it, fold it, put it down, hand sanitizer. And that you can now, you want to go one step further, have a paper bag in your car. Take the mask off, fold it, put it in the paper bag, hand sanitizer. When you come to use it, open the paper bag, hand sanitizer, open the paper, take it out, hand sanitizer, and you got it on perfectly, right?
Okay, thanks.
You can keep it for a week. Because I know you don't want to necessarily, you know, a mask a day, right? It gets expensive.
Mhm. That was my point. Thanks.
Yeah.
I have
Yes,
a
go ahead.
question.
Yes, go ahead.
About say we're using a fabric or a paper gown, and we're taking it off at the doffing station outside of a resident's room.
Yes.
Do we want to fold that gown inside or to the inside or to the
No,
outside?
for the shift, if you're using if you're using the paper, you can still have, I would have a hanger. I would have personally, I would recommend one of these stands which you can hang things on, and I would just put it on a hanger, and then you can keep the inside clean, put it on a hanger and hang it, and then people know that's dirty on the outside. Then you can put it back on and label it. You understand what I'm saying?
So we're not turning it inside out.
You don't have to, but you know that's contaminated on the outside. So people, you know, you don't go along and touch it, right? So when you're putting it back on, you're going like this, hand wash, you're going like this, put it back on, now you're doing an extra hand sanitizer, right? Because you've used a reusing it, and then you start your next process.
Okay.
So just be aware, always be aware. Is this contaminated? Yes, it is. Okay, hand wash, put it on, hand wash, next parts, right? Always think ahead. So before you go to the next step of a PPE thing, always go, okay, am I dirty or am I clean? And that's what we've always used. When I was back in nursing school, was always, is this dirty or is this clean? Ah, dirty. Okay, that. Oh, is this dirty or is this clean? When you know when you're going from clean to clean, you're okay in between and dawning not to have to hand wash. But if you're going to go, okay, that's dirty. Okay, I'm reusing that. Okay, hand wash, thing, hand wash. Next step, right? Always in your head, dirty or clean. And if you do that pattern, and after you do this a while, the first day as the outreach team or the outbreak team, you'll be going a lot. Oh, it's just dirty, clean. After a couple of days, you'll be totally into it. Okay, you'll be knowledgeable on it. It's a learning curve, but it's very quick. Okay, and always remember, you're going to go, I'm going to do this. I'm going to do this good, and I'm going to stay clean. Meaning, I'm not taking it home. So how do I do that? Okay, dirty, clean. Always think. Never rush. Always think. Right, and you'll do well. Next question. Anybody else have a question? Kristen, anyone's documenting a question?
I don't, there's no questions in the chat right now. So.
Wow.
Last chance, anyone else? You've done such a good job. You know, one thing, just so everybody knows, we'll be doing another edit to our plan that will now include what was 2 hours ago called our ORT, now affectionately referred to forever as the BORT, into the plan. And so we'll have that out to programs and posted to our website and the other places it lives by end of day today, tomorrow at the latest. But before we say goodbye for now to Gus, does anybody have any final questions or comments? No? Okay, well, I'd like to again thank Gus.
No problem. Yeah. I'm very impressed. Not enough questions either means you did a really terrible job, or if you, well, that can happen, right? You can have where people just go, oh man, I learned nothing, but I'm not going to say anything. Or it can be that you
comes up for people after we've logged off, then by all means you can send it by email, and we can compile a list of questions and send them off to Gus and get answers to those. Of course, this isn't your last chance to ask questions and have things clarified. I'd also like to echo both Gus and Rhonda, who acknowledged everybody who's put their name forward for our BORT. We really do appreciate and recognize your effort. So thank you so much for coming today and for taking on this additional responsibility. I'm just seeing that Lee has shared something in our, which isn't opening for me. So I'm not sure if, what is it, Lee? Can you, is it possible for you to share it a different way? Was anybody able to open Lee's message there? Looks
No,
like-
I haven't been able to.
Can it be asked?
Lee, we're on the edge of our seats right now.
Is it a question or is it a sharing?
No,
of a
it looks like he's posted a photo, but I can't get the photo to open. And it looks like he's working on it. Are you working on it? He's not working on. He's
Lee.
okay.
I got it open.
Oh, okay.
It's
Chelsea has it.
Chelsea's got it open.
A t-shirt that says BORT rocks.
Oh, does it? Can you share your screen to show the rest of us?
What does it say?
1 second.
All right, let's see. BORT.
Oh, that's great. That's great.
So, and just to also let you know that when I was doing the preparation, I did also quickly look up what BORT means. And
Wow.
in a dictionary, it actually means fortified.
Oh,
So it turns out to be that your acronym is actually a pretty good one because it means fortified, right? So that's actually very positive. So
you have no idea how much I love this. Like this is worth this 2 hours. Yeah, and that you would even go and look that up. Like,
well, there was a reason for that, right? The reason I did that is when I was preparing all this, and I said, maybe call it BORT, but then I thought, what if it means like you're a nutcase or something, right? So I wanted to make sure I didn't use the wrong acronym, right? So it's something that I do just in case somebody says, well, do you know what that means?
we love our acronyms around here, so I do appreciate that. So
yeah, we also for us also ours is VERT, right?
Okay, like green.
Emergency response team. So we felt that our acronym was also nice,
And you made your t-shirts green.
The VERT team, yeah.
Yes.
So yeah, it was all positive. But again, we're wrapping this up now. I just want to thank everybody for attending. If you have any questions, forward them to Kristen. I can answer them. And again, it doesn't have to be today. Anytime during the week you have a question. Of course, also, if you ever do have a positive outbreak and you need to have the emergency response team or the BORT, the outbreak response team in action, I'm always available for consultation, right? Don't worry about that. Community living groups are always, it's a very good industry because community living groups have a tendency to be partners and also share information willingly. We don't try to protect our little territory and go, oh, no, we're not going to tell this. When we have something that other people can use, we share it because we want to have people's lives protected, and we believe in quality of life, and we believe in safe lives in community. So always beware that we're available. If we have something to share, we will share it. But again, thank you very much. You guys are terrific to volunteer for this, and wish you nothing but safe next few months, of course, as the vaccine is going to roll out within the next few months. The health professionals, including community living, will be the first ones to get it. So most likely we will start receiving the vaccines around February of 21. So we're having an ending coming soon, okay? So know that we've lived in a crazy environment for almost a year, but it's coming. The end is near, okay? But in the meantime, stay strong, stay safe, and thank you very much. And Kristen, if there's any follow-up you want to give me today or later, go ahead, okay? Otherwise, I
Will do.
really appreciate this.
Great. Thank you so much.
Thank
All
you.
right.
Thanks, everybody.
Thank
Bye,
you,
everybody.
Gus.
Thanks,
Thank
Rhonda. Have a good day.
Thank you very
Thank
much.
you. Bye-bye.
Bye now.
Home coordinator